to share his perspectives on a number of the different issues we were able to talk about today. We didn't get a chance to talk about some of the animal health issues that are very important that we've communicated about. You might want to just briefly address that in your closing remarks, Mr. Secretary. And then the other thing I was hoping that you might be willing to address, since this is your 22nd forum of this type across the country, in addition to disaster programs, in addition to industry-specific challenges in dairy and pork that we've talked about, in addition to the ongoing debate regarding climate and the need for energy policies to accompany it, in addition to disaster-related issues, infrastructure issues, I know that you've been hearing a lot about healthcare. And as I look across the room here today, I see a lot of people I know, and I know many of you are paying top dollar, as many farmers and ranchers do, in the individual market to buy health insurance. I know some of you have spouses who work off the farm in part to qualify for the health insurance that the small business employer offers. And I know that some of you are uninsured. And while we are grappling with this issue in Washington, and we have, work to do to hammer out the details, one thing that I've heard across the state over the past many months is that the status quo is not working for a lot of my constituents. And the status quo is breaking families and breaking businesses and breaking the country. And I'm just curious if you, what you're hearing across rural America as it relates to the healthcare debate in terms of specifically what they're telling you and the work that those of us who represent rural America are trying to do to improve these bills and to do right by citizens in rural America.
Well, let me just address both of those issues quickly. There's basically three components to the healthcare discussion. First of all, you hear people express concern about the fact that they can't get insurance. They can't get it because they've got a pre-existing condition, or they can't get it because they've got a relative who's been very sick and they can reach some kind of lifetime or annual limit. In rural America, if you live in a town of 2,500 people or less, you have pretty near a 1 in 4 chance of being uninsured. 23% of rural America is uninsured. That is a much higher percentage than our urban and suburban friends. Now, when you have a high level of uninsured, it would be okay if those people never got sick, but like everyone else, they do. And because they don't have insurance, they can't get to the doctor, so they wait and they go to the hospital. Hospital takes care of them, as they should, but then the hospital is confronted with the economic reality of, well, who pays for this? So what they do is they essentially shift the cost to the folks who do have insurance. In rural America, on top of the money that the president talks about in terms of the average American family paying $1,000 more, in rural America it's actually $2,000 more, because rural folks pay more for co-pays and deductibles. And in many rural areas there's only one provider. So it's not like you can say, well, I don't like the deal you're giving me, I'm going to go down the street and get a different deal. In many cases in rural America there are no different deals, you just have to basically take that deal. So more uninsured and more expense for those who have insurance. And that's compounded by the fact that it's hard in rural America, because there are so few insured and the costs are high, it's hard to attract doctors because of the reimbursement rates for some of the government programs. Because we have a more senior population in rural America, the Medicare reimbursement rates make a difference in terms of where docs locate. And you know, and I know, that folks in the Midwest, the upper Midwest, don't fare very well when it comes to the reimbursement system, because it doesn't reimburse for quality, it more or less reimburses quantity, right? So there's fewer GPs, fewer specialists, less access to critical care. So whether it's access, affordability, or quality, rural America under the current program doesn't fare very well. So our hope, obviously, from the USDA perspective, is that we get some program that provides choice and competition, that addresses the cost curve and rewards those who provide quality care, which often happens in rural communities. On the animal health issue, I would just simply say that we conducted 14 hearings on the animal identification system. So a lot of angst about that, a lot of concern about it. Only 30% of farmers in the country participate. I know that Congress has lost patience with the system and is significantly reducing the funding for it. So we listen very closely. We are almost ready to announce what we think needs to happen. But I want to leave this audience with one unmistakable impression. We listen. We listen hard. We heard cattle operators tell us about confidentiality issues, about privacy issues, about liability issues, about cost issues. We heard the differences between pork producers, poultry producers, and sheep producers and cattle. The challenge we now have is we went out, we listened. Is there a way in which we can respond to all of those concerns, which we found to be quite legitimate? And I think we're going to put something on the table that is an effort to try to respond to all those concerns while at the same time creating some effort to provide some degree of traceability so that if there is an incident, we're able to contain it so the entire market doesn't get hit with, as we saw with one cow walking across the border from Canada. We're still trying to recover the BAC.
Well, thank you again for being here. I want to thank everyone who attended and enduring the rather wet chill that we've had this afternoon. But again, thanks to Jim and Barbara Hunstead. There's the Farmers Market, Friday Farmers Market that's set up across the way here. I encourage you to stop by. And I know that we ran short in terms of some other questions I know people have. We set cards down on the chairs. Those of you standing, we can make others available. I really encourage you to fill out those cards with additional questions or comments. Our staff will pick them up, and we encourage you to let us know your thoughts, and we will get back to you and be responsive from both of our offices for those of you that didn't get a chance to ask questions. But Mr. Secretary, it's been great to have you here in South Dakota. Thank you once again for being here.